You are listening to the Horse Radio Network, part of the Equine Network family.
Welcome back to the Horse HealthCast. I'm Jenna Bosgardin, Manager of Digital Marketing at SmartPak.
And I'm Ashley LeCompte-Lozich, Head of R&D for SmartPak. And today we're taking you through one of the scariest things that can happen to a horse owner, and that is colic surgery. But we're going to be joined by our very own resident veterinarian, Dr. Liz Schatz, to hopefully make it feel a little bit less intimidating.
And we got to be real. We can't take the fear out of colic surgery, but we can definitely understand it better and therefore be better prepared if it ever were to happen. So I'm going to throw some salt over my left shoulder. We're going to knock on some wood and we're going to bring in a professional to get us started.
Smart solutions, trusted voices. Your source for equine health and wellness. This is Horse HealthCast by SmartPak. The discussions in this podcast are intended for educational and informational purposes and are not intended as veterinary advice. You should always consult with a licensed veterinarian or qualified equine health professional before making changes to your horse's diet or care plan. Hosts and guests cannot guarantee the reliability, accuracy, or completeness of the information shared, and as such, these discussions are not a substitute for veterinary or professional guidance, and any actions you take are at your own risk.
All right, welcome back, everybody. It is ColiCare Anniversary Month. So that means we at SmartPak have been doing ColiCare for almost 15 years. We started the program in August of 2012, which is crazy, but it feels like this is a really good time to talk about ColiCare, which we'll get to, but also colic surgery. And we're gonna explain why in a second here.
Yes, we're going to start with a quick disclaimer, because what would a episode on the pod be without Jenna and I overtly disclaiming everything? First of all, nothing replaces your veterinarian. Obviously, Dr. Liz is here to explain to us why it is so important that you involve your vet from square one. And then two, similar to eyes, colic is always an emergency. We don't wait around and see if things get better. You're always calling your vet. You're always treating this as it is an emergency, because it is, and things can go wrong really quickly.
So if your horse is enrolled in the ColiCare program, which we'll explain, they are eligible for up to $15,000 in colic surgery cost reimbursement. It's easier to go through and actually do the paperwork than it is to say, I promise. So we're going to go more in depth on what that means closer to the end of this episode. We really wanted to start this out with talking about colic surgery itself. And to do that, we need to introduce today's guest, who some of you may remember from our very first episode of the year. Thanks for being with us, Dr. Schatz.
Thank you so much for having me again. This is so much fun. And it's nice to have Ashley here too.
Yeah, absolutely.
We always talk about how the pod is the best day of our 2-week existence, where we get to come on. And so we're really excited to get to share that with you again. Actually, I was not on the pod where you were. I was on vacation. So this is my first time with you on here. I'm excited.
Yeah.
Look at that, the gang's first ride.
So much fun. So much fun.
So Liz, if you don't mind, would you give us just a little background? I know we have a whole episode about your time as a veterinarian and what you do and what you specialized in and all the things you've experienced. But for anybody who hasn't listened to that episode, will you kind of give us the nutshell, the elevator pitch of kind of where you've been and what you've done prior to being who you are here with us?
Yeah, of course. So I graduated from Kansas State vet school. And so the whole time I was in vet school, I really loved equine surgery. They were just, I don't know, the most fun rotations, and our clinicians were really cool and fun. And I was like, I want to do this. This seems like a fun path to go down in my career. So my first internship was at New Jersey Equine Clinic, and that was just surgery. So, and I guess disclaimer from me, I am not a surgeon. So I'm not a board certified surgeon. I have done surgeries and I have scrubbed into a lot of colic surgeries, but just disclaimer before we get really into the meat of everything, that I am not a surgeon. Like I said, my first internship was at New Jersey Equine Clinic with some great clinicians there, and we just did elective surgeries. So we actually didn't do colic surgeries there, but we did airway surgeries, we did orthopedic surgeries, really bad wounds, things like that. And after that, I sort of wanted a more well-rounded experience. I was still wanting to go do a surgery residency at that point. So I went to, my second internship was at New Bolton Center, which is super cool. I got to do, it's a rotating large animal internship. So you do medicine, surgery, sports medicine, you get to be in the NICU. It's really, really fun. Lots of really cool cases, obviously. And that's where I saw a lot of colic surgeries, scrubbed into a lot of colic surgeries. So I've been there firsthand, seen, all the things that you can see in a colic surgery, more or less. And we'll get into that a little bit later. But after that, I actually did a research fellowship at New Bolton, which was really cool. I got to see like orthopedic models in large animals, mostly for like human orthopedic implants and things like that. And after that, I went into private practice. So I was in private practice at a mixed animal practice for a few years, and actually ended up at a small animal shelter. But that's a whole other story. Maybe go back and
Yeah,
listen
but
to that
that
episode.
winding road brought you to us, and we are so grateful for that now you are our staff veterinarian. So,
Yes.
all things happened to bring you here. So,
It's been a very winding road, but I'm very glad that I landed at SmartPak for sure.
I mean, it's really
So,
cool just the amount of different experience you have that you bring to the table too. And like you and I talked about this, we could talk about it even further, but I appreciate you kind of giving us like the recap overview of a lot of the stuff that you've gotten to see and experience, like the different facets of the veterinary life that you've led. And then also very briefly for anybody wondering, I know you have a few horses at home. Will you give us like just the quick rundown of who you've got in your fields right now?
yeah. So, I have 3 off-track thoroughbreds. I'm a big OTTB fan. I do volunteer work for some thoroughbred aftercare organizations. Love the thoroughbreds. I could talk about them all day too. But yes, so I have Wyatt. He was a graded stakes place. No, I think he was a stakes winner, not a graded stakes winner or graded stakes place. I think he was just a stakes winner, but he was a really good racehorse. That's Wyatt. I think he's 12 now. And then I have the clown of the herd, and that's Homer. Homie. He is my big goof. He is, I think, 8 now. And then I have Henry. So Henry's 4, just turned 4 in February. He never raced, but that was not his fault. It was just because it was a whole situation. But he never raced. No fault of his own. So he's the one that I'm riding now. And he's been so much fun to bring along. I really have, we're going very slow. I've only ridden him a handful of times. We're starting to have lessons with my event trainer. So fingers crossed that continues to go well because he's been really fun.
You know what? Next time we have you on the pod, you'll have competed him in a couple of events by then. So we'll keep getting Henry's updates as we go through. But
I think we're going too slow for that for that to actually happen. But
a fun fact about Liz's horse Homer is that, okay, so when we're bringing new products to market, we always do palatability testing. And sometimes for context, Dr. Schatz is a member of the research and development team. So I get to work with her every day. Lucky me. And we have such a great time together. But we also use our own horses when we're lucky enough to palatability test products with our own herds. And Homer is like notoriously the ain't no way horse. So like if we have a questionable product or we think like, oh, this is the most palatable product we've ever made in our life, he is like the ultimate litmus test. Like if we send it to Liz and Homer eats it, like this is going to be a 10 out of 10 product. He does not, he's the toughest critic out there. He's like the Gordon Ramsay of dietary supplements for horses. He really is. He really is.
Now I'm never going to look at him the same way. Thank you for that. He definitely has opinions. He has opinions. He also
he does.
he has opinions about most things in his life, but he's very
he's
happy.
definitely
So
out there calling us idiot sandwiches sometimes, and I respect him for
He
that.
is, for sure.
Yeah.
For sure.
yes.
What is this, banana flavor? Get it out of here.
Horrible. Get it out
I
of my.
specifically requested peppermint. Yeah.
Oh, he does not
Okay.
like peppermint. that would
I'm
be a
sorry.
no.
I got it backwards. Lord
He's
help me.
definitely calling you a name right now for not remembering
For
his
sure.
very specific tastes.
Very
For sure.
specific. Yeah. Yep. So that's my crew, and then we've got a bunch of other animals as well that just keep me laughing all day long, basically.
Which is important here because as fun as things are, we always do take things pretty seriously, which unfortunately is my not so subtle way of segueing us back into an episode that's
That's
a little
right.
bit on the
Yes.
funnier side. So I appreciate that we started out with a little bit of levity and remembering Homer's very particular proclivities for taste. But with this episode, we're going to talk a lot about colic surgery and the things that go into it with the intent to make it a little bit less terrifying. At least for me, I know when I'm armed with knowledge, I feel a little bit better about what I'm going into, even if I don't have control over what's happening. So that's at least my goal with this one. And just for anybody listening, if this is, making your stomach squirm, if you're about to call the vet so you can get some GastroGuard for yourself, like, don't worry, right there with you. It's not the most comfortable topic for all of us. I think it's important for us to know, what can happen, what can go right, and what can go wrong at the same time. So, Ashley, you kind of alluded to it at the beginning where you said that like eyes, colic is always an emergency. But I kind of want to talk about what that means because colic is a pretty broad term, and we're going to talk about colic more in depth at a later date. This is specifically about surgery, but when when do we know, Dr. Shots, if it's a true the vet needs to come out and something bad's happening, emergency, or if it's we walk around for a while, or is that something that we can't determine ourselves as horse owners?
Yeah, and it's a really great question. I will say, even now, like I have vets who are also my colleagues. One of them was my intermate at New Bolton, so that's really fun. But I have horse vets, right? Because I don't practice anymore. So I have horse vets that come and do all this stuff for my horses. Um, and as soon as one of my horses is colicking, I text them
You're
because
like, I forget. Help me. I can't. It's too close to home. Please.
all well, not that so much. I mean, I assess them and give them
Sure.
Banamine or whatever but I want them to know, right? So I want it to be on their radar that there's a horse colicking at my farm because I know that things can change really quickly, right?
Yeah.
So I just want to give them a heads up. And maybe that's annoying to them. I have no idea. But for me too, I mean, if I were still practicing, I would want to know, right? Like I would want to know there's a horse colicking and, if I have questions, if
Yeah.
the owner has questions for me, whatever. So I will say almost any colic, if you have a vet that you feel like you can reach out to sort of semi-casually and be like, hey,
Sure.
just a heads up, it's not a bad idea. That's sort of what I was getting at when I was talking about harassing my own veterinarians. I have had horses here at my farm since we've lived here. We moved here in 2022 and we've had some colics. And I have, like I said, I have let them know every single time just to give them that heads up. So
Something nice for them to have it in the back of their mind that
Yeah.
if a phone call is coming, they need to know what to wrap, what to be prepared for, who to alert, and
Right.
things like that. So if they're, like you said,
yeah,
if there's a way that you can be in touch with your veterinarian themselves or their office or something, it's not a
Yeah.
bad idea just to give them the quick note in case something does
I
go
can totally. I mean, it's also worth noting too that like horse doctors are ambulatory. So like it's nice to let them know that they may have to come out for a visit soon and kind of
right.
keep them prepped. Yeah.
Right. There are two vets in the practice that I use, and like they can figure out who's closer to me, what might work best for if they have to come out. So I will say, like, there are people that are comfortable managing mild colics. I think that's fine as long as, they are perfectly comfortable doing what they know how to do. If that's taking a TPR, so that's temp pulse respiration, that's sort of the basic, just to get basic data, basic information about what's going on. Owners can even listen to gut sounds if that's something that they're accustomed to doing. I've known horse owners that know how to listen to gut sounds. It's not a bad thing to learn how to do. It's not hard. You just have to sort of practice. If you listen to a normal healthy horse on a regular basis, you know what things are supposed to sound like. And then if your horse is colicking and you listen and it sounds different, then you're like, okay, there might be something going on here. And that's information that you can pass on to your vet. I will say I wouldn't encourage an owner to try to manage anything that's, going on for a long time or the horse seems really painful or something like that.
Yeah. Can we like double click into that? So like I'm the horse owner. What am I looking out for as the horse owner when I say like, okay, this is crossing the threshold of like, I can handle this myself to like, now it's time to get my vet here.
Yeah. I will say it doesn't take much for me to recommend that you get your vet there.
Okay. So baseline.
Again, yeah, like if you're comfortable giving Banamine and that's keeping your horse comfortable, that's great. And like I would say, okay, you can monitor that horse for a few hours, see what pull their food, see what they do, see if they poop. It's always always an exciting time when a
Right.
colicking horse actually passes some manure. But yeah, I mean anything if you're not able to keep that horse comfortable. And by that, I mean, not pawing, not rolling, they can be a little iffy, but if they seem like they're actually painful, I would get the vet out.
Okay. So we've done everything. We've walked, we've done the Banamine, we've offered hay, we've offered water, whatever it is. They're not eating, they're not drinking. Initial symptoms are not improving. Is that
Right.
fair? Like with
Yeah.
Banamine and at home care, symptoms are not improving. Like now it's time.
Yeah.
Okay.
People will hand walk and I've known people that sort of like furiously hand walk the horse, and that's really not necessary. When I hand walk one of my horses, they're in a stall, they're not feeling well. I take them out of the stall, I walk them around in a few circles, see if they'll pass gas or pass some manure, and then put them back in the stall. You don't have to furiously walk their feet off. I
Okay.
think that might be something that people, a more old school way of going about trying to like manage a colic in the early stages, but you certainly don't need to do that. They don't need to walk the entire time until the vet gets there, unless they're thrashing around and it's
Right.
safer for everybody for you to be walking
If
the
they're
horse
moving.
around.
Okay.
Yeah.
Okay.
Yeah.
Yeah, it's
So
fun what things
go
have
ahead.
changed over the years too, because I know as a kid, if there was even the sign, a hint of colic, that horse was out of the stall and you were trying to break land speed records on walking around the indoor or walking around the
Totally.
property just to see if you can, fix it, change it, improve it, whatever it is. And then later on in, my early and mid 20s, we had a horse who was chronic. And when I say chronic, every time his owner left the country, he colic. I don't know how he
So
knew.
perfect time.
Every time. So if I was teaching lessons on a Friday and I knew that his owner had hopped on a plane, like I would just have him in the indoor with me, not to power walk around the ring, just because I knew he was going to be down and thrashing, and it was better if I had him on the lead rope. So it's interesting how it's great how our information changes, and so we can change how we work with and support the horses that we're hopefully going to see through to the other side of the colic.
Yeah,
That would
absolutely.
colic every time he trailered from Maryland to Florida. I lived in Florida and I went to boarding school in Maryland, and every time we trailered him, he would colic. And we like figured out how to manage him, but there are just some horses that are prone to it, and
Yeah.
there are ways to manage certain types of colic. So
Yeah, and when it comes to a colic okay, so we're going back to Ash's example where we've pulled our house horse out of the stall, we've done some walking, whether at marathon speed or gentle around the ring, whatever you're comfortable with. We've offered hay, we've offered water. They're still showing signs of discomfort. They're still trying to go down. They're still kicking. They're still biting. They're still obviously showing signs of discomfort. We've called the vet. The vet's now out and we're monitoring. Are there are there things that our veterinarians are now looking for that tell them like, hey, this is now a candidate for potential surgery and we're getting on the trailer versus we're keeping them at home and it's probably going to be okay? Like, what are the signs, I guess, that you're checking off to be like, put that horse on a trailer yesterday?
yeah. So when I would first arrive to look at a horse for a colic, again, you do a TPR, a temp pulse respiration. So, make sure that it's not a fever that's making the horse uncomfortable. I've certainly seen horses that have had a fever that act just really uncomfortable. I mean, if you've had a fever recently, it's
Yeah.
I'm
not
kind of a
great.
baby when I have a fever, so I
Yeah,
get it.
it's not a great feeling. So make sure that they don't have a fever. The pulse is really important. So a horse's normal pulse is usually like 28 to 48, depending on breed, size, temperament, things like that. Can be a little high because of fear. So like white coat syndrome, that kind of thing. In dogs, horses will show the same thing sometimes. Horses that don't particularly like veterinary, well, their pulse can go up a little bit initially. So a lot of vets will get a pulse, and if it seems high, but the horse seems a little jittery, you go back later on in the exam and do it again. So respiratory rate can be helpful too. When a horse is uncomfortable, they might have an increased respiratory rate. So that can help us. And then, like I said, we do a check for gut sounds. You check in all four quadrants of their abdomen. So left and right, dorsal and ventral. So it's like just four spots that you can hit with the stethoscope to listen to the gut motility. So normally their guts are moving constantly. And so when you listen, you'll hear little noises. You can actually hear stuff moving through their intestines.
And it should always be like a low level, like gurgle or rumble. Like essentially, what it sounds like when your stomach rumbles loudly, that's kind of what's almost always going on inside them, just a little quieter, right?
Yeah, yeah.
Okay.
Yeah. So a little gurgle, a few of those every minute or so. That's great. When you listen to the cecum, that sounds a little bit different. The cecum can sound like a toilet flushing sometimes because
I've
it
never
moves
heard that.
it moves a lot of stuff around. So, but again, if you listen to them pretty regularly and you want to
You
get
have a
accustomed to
baseline.
doing that, then you know what things should sound like. That gives us some really good information. A lot of times, in colic, the gut sounds will be decreased because the gut is just sort of not doing what it's supposed to be doing, especially like in an impaction. So impactions, if you're not familiar, it's like a constipated person, for lack of a better comparison. So the gut is just kind of not doing much. And then if they've got loose stool, diarrhea, colitis, something like that, then you'll hear a lot more sound because stuff is moving through their intestines
Okay.
faster, right? So that gives you some really good information. And then a lot of times we'll pass a nasogastric tube. So that's the little tube that goes up their nose. You usually have to sedate the horse to do that. Generally, if the horse is colicking badly enough that you're there doing an exam, you generally give them a little bit of xylazine or something anyway, just to help them calm down, make them feel a little bit better. If they haven't gotten any Banamine from the owner, we'll give them some Banamine too, just to make sure that they remain as comfortable as possible while we're examining them. So we pass a nasogastric tube, and what that does is check for gastric reflux. So if the small intestine, or even sometimes the stomach, but generally the small intestine is not functioning, or if it's twisted or something like that, they will reflux fluid out of their stomach. Horses can't vomit, so it can actually cause a really big problem. It can rupture their stomach potentially if you don't release that pressure. So we'll check for that. That gives us information about what might be going on. If there's a lot of reflux, then there might be a problem in the small intestine. And then we do the rectal exam. The rectal exam gives us usually a lot of information as well. Again, it's one of those things where if you do it and you know what it feels like normally, you know where everything kind of lives in there, and what it should feel like. And then when something is happening, if there's a displacement, you can feel a lot of different structures, and sometimes you can get a good idea of what's going on. Displacement's pretty easy to feel. Even, an impaction, you can usually feel that. Sometimes you can feel like loops of small intestine if there's like distended small intestine. Sometimes you can feel that as well. So that gives you a lot of information about like what might be, if there is, as I said, an impaction, displacement, something twisted in there. It gives you some really good information as well. So you're never going to just use one bit of that data, right? You're going to put it all together to make the puzzle of the colicking horse. So some people will also do a little bit of ultrasound. There's a really cool technique called flash, where you sort of go through their whole abdomen and take a look at all of the organs, and that gives you some information about like, is the intestine wall swollen? Is there, and you can even see like the manure moving through, so you can see if it's moving how it should. I know it's kind of gross, but it gives
Cool.
I knew the full exam did like a lot of things. I've seen people do them. I understood the concept of it. I'm still stuck on the fact that you can feel structures inside the horse's body, and on feel, you know what they're supposed to feel like and where they're supposed to be. So I'm still processing how cool that is, and just how much like knowledge is contained within a veterinarian at any given point to just be able to quite literally blindly grope around in there and know what it's supposed to feel like. And now we're talking about ultrasound so that you can actually see what's moving. This is incredible to me.
Yeah, it's pretty cool. I guess I don't think about it because it's just something that I've
So
done, but
normal.
yeah,
Yeah.
it's just such a normal thing. The bladder actually feels really cool. If their bladder is full, it feels like a beach ball. So you can like it'll be right here, and it feels just like a beach ball.
We'll put that on a t-shirt too. We'll have
Yep.
bladder beach balls. Yeah.
Yep.
That's good.
With a hand over top of it. Yeah. So you can bounce a little bit.
That's our new add it to the merch line for sure.
Yeah, absolutely.
Okay, so like the sum of all these different data points is helping you to determine if this is something more serious that is beyond the scope of an ambulatory call, and like, should we get this horse on the trailer and head to a clinic?
Yeah. And
Okay.
so there's other information too, right? Would the owner want to send the
Sure.
horse to colic surgery? Some people just don't ever want to send a horse to colic surgery, and that's a personal decision. You have to think about budget. Some owners don't realize that colic surgery is expensive.
Yeah.
It's a big deal, and it's expensive, and usually they have to stay in the hospital for a few days, and all that can be
Yeah.
expensive, and that's definitely a concern.
And
Yeah.
that horse is a perfect candidate. I know there
So
are plenty of
that's
people
where
there with the horse in their, mid, late 20s or younger than that with a variety of other health complications that just for whatever specific reason, it's not what you are able to do, capable of doing, or want to do. So we are going to talk a lot about colic surgery as we already have and will continue. But also, I guess, what's this, our third disclaimer of the episode so far? If you are somebody who's listening to this or you know somebody who's like, I would never do that, like that's a choice every horse owner gets to make for their horse,
Yeah.
for their situation,
Yeah.
and you're going to know it best. So we're going to talk a lot about
Absolutely.
what you can and should do. It doesn't matter when it comes down to what you know about your horse and your budget and your comfort level and
Yeah.
what your vet is telling you in that moment.
Exactly.
Yeah, 100%. And I will be the first to say that I like literally would walk across glass for Andy, but based on what I know about colic surgery and the horses that I've seen go through it and come out of it, I have never considered him to be a good candidate for it. So, Liz, help us to understand, like, how are we scoring horses' chances of survival through surgery? How are we determining if a horse is or is not a good candidate for surgery, so that in that moment you're having that conversation with the owner? What does that look like, and what are the different criteria that you're looking for to determine whether or not this horse should go forward with surgery?
I mean, it can be a little tough to talk about because, like you said, every situation is different. Every owner is different. Every horse is different. And so every time this comes up, the veterinarian is going to have a really serious conversation with the owner, right? So, um, does the horse have other health issues? I had a horse that colicked, and he had really bad EPM, and I had decided that he was not a good candidate for surgery. It would be really hard on him for surgery, and I ended up having to euthanize him. He's colicked really badly, and we had to euthanize him. But I had made up my mind way ahead of time that he was not a candidate for surgery. That it does make it a little bit easier in the moment if you think about these things ahead of time, right? If you prepare yourself emotionally for, what that decision entails, it can make everything feel a little bit less traumatic. It's still going to feel traumatic, trust me. I've been there multiple times.
But if you've
But
discussed it and you've made a decision ahead of time, then you're not making the first time you think about it in the moment that it's all happening and you're overwhelmed and scared and sad. Like, you at least have something to fall back on where I've had the conversations. I'm aware of what the parameters are. This is what I said before. Do I feel differently about any of those parameters now? No, then I know I made the right decision already.
yeah, yeah. And honestly, my horse that I euthanized that had EPM, I don't think he would have been a good candidate for surgery because he colicked really badly. Like, I don't think he was even going to be stable enough to take to the hospital. So that's the other thing.
Can they stand on a trailer? Yeah,
Yeah.
Yeah. Is it safe for them to get on a trailer? Is it,
totally.
is it worth putting them on a trailer when they're painful? And, we try to sedate them and get them as comfortable as possible to make the trailer trip safe. But, sometimes it's not safe. And sometimes you know that the horse has a bad prognosis. There are things in the exam. If you look at their capillaries in their mouth, if you look at their mucous membranes and their capillary refill time in their mouth, that can give you a lot of information. They can be in shock already. That makes their prognosis pretty bad. And, usually, unless the surgery center is around the corner and, you want to chance it, a lot of times those horses just aren't going to make it. So you just take all the pieces of the puzzle and put them together and offer them to the owner and say, this is what I think. This is the situation.
And so you're using the puzzle pieces you mentioned before. This is like the rectal exam, the heart rate, the respiratory rate. So all those pieces and I guess how they've either progressed or not progressed in the time that that's also been, on site are kind of what you guys use to determine, like, as a guideline, is this horse a candidate or not?
Yeah, exactly. And you can give owners all that information, and some owners will want to send a horse that has a bad prognosis to surgery anyway. Just so they can see what's going on, even if they are pretty sure that the horse is going to be euthanized on the table. Some people will do that and, pay for the surgery and take the risk. And, some people just want to know exactly what is going on in there.
You have the ability financially and emotionally to give your horse every possible fighting chance. That's what you want to do.
That's
Yeah,
right.
do it.
Yeah.
That's right.
Yep. And there's not as long as you're considering the horse's welfare, there's not a wrong
Yeah.
answer, really.
Right.
It's a very personal decision. I feel like it's up there with making the decision to euthanize an animal. Like, it's very personal, and there's a lot that goes into it. And like I said, I have sent 2 horses to colic surgery. I'm glad I did, but I have had another horse that I didn't send. So,
Yeah. Yeah.
it's I don't know. It's always hard. It doesn't get any easier. Even I've been riding my whole life, and it just doesn't get any easier. Even as a vet, it
Yeah.
doesn't. It's
Somebody
difficult.
pull the table. Like, that's a creature that somebody cares and loves about and wants to see come through. But
Yeah.
All we
Exactly.
can do is put our faith in the horse themselves and what you guys know, and know that whatever the outcome is, it's what's going to happen. So
Yep.
it's
Yep.
tough. It's not easy, and like we said, it's a very personal decision. But in a like a less personal way, like I imagine, and correct me here, that once a horse is deemed a candidate for surgery, so you've done all the exams, you've checked off your guidelines, you've determined, and you've agreed with the owner, and everyone's on board. The horse is at the clinic. We're getting ready for surgery. I think that's something that I mean, I've been a horse girl most of my life, and I don't really know what happens at that point. Like, the horse gets taken back, they tell me they're gonna update me, but, like, then what happens after that? Like, what does a colic surgery actually, I guess, entail? If that's not too broad of a question?
No, not at all, because they all start basically the same, until you're actually in the abdomen, they're all basically the same. So, yeah, let's say you're at the surgery center. It's going to be a little bit of organized chaos. So, generally vets are very calm, and vet techs and assistants and vet nurses and, whoever's working with you. Generally everybody's very calm but focused. So it feels like organized chaos, but everybody has their own job and everybody knows what their job is. Um, so the horse is going to come in. Initial assessment is generally done by multiple people. So regardless of what your vet has done at home, the horse is going to be examined again by a vet at the surgery center. Generally, it'll be the vet that's going to do the surgery if the horse actually goes to surgery. So that vet is going to take a look at the horse, basically do all the things that the vet on the farm has done, but duplicate it, make sure nothing has changed. Things can change pretty quickly. Heart rate can go up and down pretty quickly. There's always that magical trailer ride that can fix displacements. I have seen that happen. That's pretty cool. I wouldn't always count on that, but sometimes if you have a displaced horse and put them on a trailer, the motion of the trailer, much like hand walking, can sort of shake things back into place. So, the horse might not need surgery by the time it gets to the surgical center. That has happened, to a lot of surgeons. But, vets are always happy. If the horse shows up and it's doing great, that's great. Even if we've had to get out of bed to come assess them, we're always happy when they're feeling better. So again, that initial assessment is going to be done by multiple people. They'll run blood work, so that'll tell the surgeon, if there might be some infection going on somewhere, if they have a good enough red blood cell count to go under anesthesia. If there's something going on with their kidneys, it's going to tell basically functionally what's going on within the body. Again, we just do that to make sure that they're not horribly dehydrated. They don't have something else going on at the same time. So that will get run generally in a lab, like on site. An IV catheter will be placed, and that will allow IV fluids to be given. Generally, those horses are a little bit dehydrated. So most times they'll get a bolus of like 10 liters of fluids, and then they'll get turned down to a drip. That may have changed since I was practicing, but that was what we did back then. So they'll get some IV fluids, make sure that they are hydrated for the surgery. And obviously then the vet will speak to the owner, tell them, make sure they know what's happening, get permission to do the surgery, make sure they know how much everything's going to cost, they'll get an estimate for everything, and then the horse will be taken back. At that point, usually you'll go to like an anesthesia induction area. So those vary in different hospitals, but it's just going to be in most places like a padded room with sometimes there's like a little wall that is on a hinge that you can push the horse up against the horse to make it safe for them to go under anesthesia. So once you give them the anesthetic drugs, they're going to basically drop to the ground. And if you can control that, that's better for everybody standing around and for the horse.
If there's a wall on a hinge and you're trying to encourage the horse to be up against that, does that then just kind of like scoop the horse?
No, so it's like
That'd be cool.
Yeah, it would be cool. We have those for cattle. But like a
Go.
squeeze chute. No, horses don't like the squeeze chute. I'm not describing it very well. I apologize. So it's like it squeezes them against the wall. So
Okay.
you have a couple people like pushing, not very hard, but just like pushing
Holding them, yeah.
this like swinging wall to make it so that the horse just goes down, sort of
And doesn't
straight
collapse on
down
top.
and doesn't fall
Yeah.
over. Yeah.
Okay,
Because
okay.
not only can that hurt people in the area, it can hurt the horse as well. So we want it to be safe for everybody involved. So there is a controlled procedure for putting them
So
under
raw.
anesthesia. Yes. And like I said, usually there's like padded walls and everything to make everybody as safe as possible.
Okay.
Hobbles are put on their feet, and some places will pull their shoes off. Some
Okay.
places will just tape over the shoes. The places that pull shoes will usually also put tape, like elastic on tape over their feet, just because they're so dirty.
Mm.
And they are also intubated at that point. So you place an orotracheal tube, so through their mouth into their trachea, so that you can deliver oxygen and anesthetic drugs to them through the tube during the surgery. Horses that are having gastric reflux, if you find gastric reflux on the initial exam, normally you'll leave the tube in their nose that goes into their stomach so that during surgery, that pressure doesn't build up in their stomach. Yeah. So you allow that just to be sort of an open passageway out of the stomach through the nasogastric tube if they're refluxing. Usually if they don't have gastric reflux, you don't really need to do that. But that will just eliminate the possibility of all of that fluid filling up and injuring the stomach during the surgery. The surgery can take a few hours.
Mm-hmm.
So, you want to make sure that nothing is gonna happen to make things worse during the surgery.
Yeah.
Yeah. Keep everything as stable as possible. No pun intended.
Yes. And then, so with the hobbles on their feet, you attach those to a hoist. So think of like a crane, a giant, giant crane, and that hoist will pick up the horse and put them on the surgery table. So at that point,
I
they're
guess
on their
there's
back.
no world where there's like enough people and staff that can lift an animal onto a table. Like machinery is going to be required for that one.
Yes, heavy machinery. If it's a draft horse, usually you use 2 hoists. So
Man,
yeah, think about doing a surgery on a draft horse. It's an interesting experience for sure.
okay. This is going to sound silly, but I mean it as a real question. Do you still use the hoist for like a mini? Like, do you just do it in every case because it's like the safest way to lift a horse? Or do you just pick up a
Yeah.
mini and put it on a table? Okay.
Yeah. Yeah. I mean, if it's like a foal or something, you can pick them up.
Without too
And
much effort. If there's a
foals are a
little.
little bit daintier. Like you don't always
Mm-hmm.
want to hoist them around.
By their legs, yeah.
But yeah, for the most part, the procedure is the same for every horse, regardless. You obviously make changes in like the drugs and things like that, depending on the size of the horse. The procedure is a little bit different, but the steps are the same, regardless
Okay.
of what the horse, the breed or size.
So then once they're on the table, you're opening them up and digging around in there? Like, I guess,
Yeah.
what is that?
So that way they're upside down on the table. They get rolled into wherever the surgery happens. The surgeons go and scrub into surgery, and the techs, assistants, nurses, what have you, scrub that abdomen, clip the hair off the abdomen, and scrub the abdomen so that it is as sterile as possible for surgery. Excuse me. As soon as the surgeons are scrubbed in, they come and put a drape over the entire horse. So there's like a giant drape. Think of like a king size sheet, like flat sheet. And as long as you check with the anesthetist says like the horse is stable, everything's fine, we're ready to go. Then you make the initial incision in the abdomen. And in a horse, that's a very large incision. So
Wow.
yeah,
A lot of abdomen there.
it's a big incision. Yeah. And then at that point, again, I'm not a surgeon, but worked with a bunch of surgeons. They all have their own way of sort of navigating their way around in the abdomen to check everything. So even if you think you know what's going on, you check everything you can possibly see and or reach. And a lot,
To look for like the root cause of why this horse is colicking, right? That's the
yes. Yep.
Okay.
So you're going to find, in most cases, you're going to find the problem. But since you're in the abdomen, you check everything. So
right.
you exteriorize as many things as you can. So that means like actually bringing it up out of the abdomen, looking at it, putting it back.
Yeah, leave no stone unturned kind of thing.
Yeah. And you trace the entire GI tract, basically.
So
Again,
it's like hands-on, like pulling it through and making sure you can feel every piece of it so you're not missing anything that could be in there.
Yep.
That feels like a
Yep. So
long time. There's a lot of that, isn't there?
it's a long time.
Wow.
Yes. And the colon is very big and heavy. And so the surgeon is like lifting this giant heavy colon like up out at least to the incision, if not out of the incision. So that's a lot of strain on your neck and your back, and
Yeah,
it
I was
takes
just
a lot
thinking
of
the
strength.
core workouts that all of the surgeons should be
Yeah.
doing. Like everybody should have some kind of kettlebell routine at home for that.
Yeah. One of my colleagues was like a CrossFit person,
Mm, yeah.
and yeah, she was
Yeah.
very,
Like you
very
have to
fit,
be.
very fit, but very fun. to work with. So she's fantastic. I think she's doing small animal surgery now because she's a genius.
And because she was like, I can't lift hundreds of pounds of bowel out of
For
this horse
your
anymore.
whole life. Like, think about if you're an equine surgeon and you have to
Man.
do that forever, like,
Yeah.
it's wild.
Takes a
That's no
toll.
joke.
Yeah. So then at that point you identify whatever it is that's going on. If it's a displaced section of the GI tract, you're going to examine it and then put it back as best you can,
Sure.
where it actually belongs. There are all kinds of things you can find during surgery. I don't know if we want to talk about, the potential findings during a surgery, but I can go through that if
I mean, we're here and you've got my attention.
I mean, I'm
I
bought
feel
in,
like
so
I'm
I
watching
personally,
like Nat
I
Geo
wanna know.
right now or something. I say let's go for it.
Okay. So where should we?
I mean, Sound of Music says at the very beginning, it's like, what's the first thing? Like, if you're picking up organs, the first organ you pick up, like, what's the thing that you could find there?
Well, the first thing that usually comes out is the cecum.
Okay.
And I don't know why. I don't know the history of this, but surgeons call the cecum Sparky. I don't know why, but it's like a thing. I'm sure the internet knows. I'm sure it.
I'm going to Google it while you finish telling us what's going to.
And if we can't find it on Google, hopefully somebody in the comments will tell us.
It's the internet. I don't know if there's surgeons listening. Tell me why it's called Sparky. I might have known at some point. But Sparky sort of is like your tour guide for the abdomen. You kind of know where the cecum goes, and it's really big. So it's always easy to find it. And it usually pops out because it's filled with gas. So you make the incision, and the first thing that comes out is the cecum.
It's a volunteer.
It like comes out and says hello. And it's like the tour guide, like I said, of the abdomen. So, and the other thing that I haven't really covered is why these things happen in horses, right? Like, you don't see people having all sorts of, I mean, it can happen, but
yeah, I mean,
having
for
all
all
sorts
the
of,
bad
like,
things that I've eaten, all the trailer rides I've gone on, all the stress I've been under, knock on wood, I have yet to have to go in for colic surgery. So
yes. So horses have, like we said, an extremely long GI tract. And the problem, well, one of the problems is that the attachments inside the abdomen are not great. So
perfect.
whoever designed it, so it's pretty mobile. Most of the GI tract is mobile inside the abdomen, so it can kind of move around and do whatever it wants, which can be a problem.
So I mean, that sounds a little bit concerning, but you said it so casually. I feel like maybe it's okay.
It can be fine. And actually, there have done some. I don't know if it's been published, but there's a whole genetic line of horses that has especially bad attachments in its GI tract. Like,
great.
So yeah, and they colic, so more than the average horse, if that makes sense. So it's the fact that the GI tract can just sort of move around at will.
Interesting.
And it's also very heavy, and that could cause a problem. So if you have a big heavy loop of intestine that flops over on itself, then it might get stuck there.
Sure.
So the things that you can find, the first that we think of is a strangulation. So when I think of a strangulation, I think of a strangulating lipoma or a pedunculated lipoma. So it's like a little ball of fat on a stalk, like a yo-yo. So if you think of it like a yo-yo, and then if you think about this string on the yo-yo getting wrapped around a piece of intestine, that's what happens with a lipoma. So that will sort of like make a stricture around the intestine and cut off the blood supply.
Oof.
Yeah. So that section of the intestine can basically die, necrose, when that happens. So that's one thing that you see that tend to be common in Arabian horses, but they can happen with any horse. They tend to be more common in older horses. I'm not sure why that is. I don't know if it's just like the accumulated fat over time or if it's an actual like pathology with aging, but tends to be a little bit more common in older horses.
Which is interesting. And it's not to say that it's a guarantee. Like, if you have an Arabian horse, you do not need to go panic and like buy up every kind of life insurance you can on your horse. It's just something to kind of be aware of. The same way we know that warm bloods and minis are prone to fat and metabolic issues. Like, it's just something to have in the back of your head.
Thoroughbreds have terrible feet. It's just a thing. My thoroughbreds thankfully actually have really good feet. So knock on wood.
Now
I'm knocking on wood. But one of One of them is missing a shoe at the moment that I can't find. But yeah, no, it's just it just tends to be more prevalent in Arabian horses. It can happen in any horse. For whatever reason, we know that they happen more frequently in Arabians than in other breeds. The other term that's thrown around is entrapment. When I think of an entrapment, usually I think of a nephrosplenic entrapment. So there is a space between the kidney and the spleen on the left side of the abdomen that intestine can sort of like get stuck in. There are horses that this happens to regularly and they don't have a problem. But if the loop of intestine sort of gets jammed in there, or if it swells up, or, if some manure is moving through and it makes it a little bit bigger, it can potentially get stuck in that spot.
Okay.
So that's one of the things that we can see on ultrasound, actually.
Oh, that's cool.
If you suspect a nephrosplenic entrapment, you can check that spot and see if there's a loop of intestine stuck up there. You can also have something called a mesenteric rent, which is a hole in some of the tissue that attaches the intestine, like to the abdominal wall. If there's like trauma or something happens and you get a hole in that mesentery, loops of intestine can go and get stuck through that rent, and that can
Crazy.
strangulate the intestine as well. They're not very common, but that can definitely happen as well. So that's the other thing that I think of when I think of an entrapment. And then, so there's a layperson term that a lot of horse people use, which is a twist. So,
Mhm.
People say, oh, is their gut twisted, or did he have a twist? So that's usually what we're talking about is a torsion or a volvulus. So that is when a torsion is when the intestine sort of twists on itself. A volvulus is when the whole mesentery turns, twists, and strangulates itself. So that
Okay.
the mesentery is like a tissue that attaches the intestines, but there's also the blood supply in there. And if you twist that off, it strangulates the blood supply. So volvulus is the one that, if you suspect it, that horse needs to be at the surgical center like yesterday.
Yeah.
And I
'Cause that
know we used to like colloquially worry that if a horse is down and rolling, they're going to twist something. Is that a true concern? Like, is that how that happens, or is that just kind of like wives' tale? That's what we generally can understand as non-veterinarians, kind of thing.
Yeah, there's always a concern. And, when we move animals around for surgery, there's certain ways that you turn them because, there is a potential that their intestine can turn when you turn them, can twist
Okay.
on itself. But, we don't entirely know what causes a lot of these forms of colic. We don't we don't fully understand it. A lot of it is just changes in motility and things like that like horse gets really dehydrated and their gut stops moving the way that it should. The fear for me when a horse is down and rolling is that it's going to thrash so hard that it hurts itself or a
Okay.
person. So that is why I don't have a problem with a colicking horse laying down. That's not going to do anything, right? They can even roll a little bit. But if they're like down and thrashing, the vet needs to be there
Mhm.
pretty immediately. And those are the horses that we want to try to get up and walk because it kind of distracts them.
Yeah.
But that's not always safe. So safety is always first, right? If you can't safely get near that horse, wait for help, wait for your vet, don't get hurt.
Yeah.
I've definitely seen people getting hurt because they get trapped, with a horse that's thrashing, and that's just
Right.
not
Trying to do the
it,
right thing. But at the end of the day, the rolling itself is not
no.
likely causing anything worse. But if they are thrashing and going to cause harm, that's where we really need to be concerned.
Yeah. That's my bigger concern when they're down and sort of thrashing around like that, is that they're
Okay.
gonna cause a different problem. They're gonna crack their head on something. It's
Okay.
certainly possible that if they roll, it's gonna make things worse. I definitely don't ever want them violently rolling because
No,
it's
but if
just
they
not
lay
good.
down, they take one little turn on their tummy, like we're not making it worse. We're not creating a twist that didn't already happen, most likely. So
Yeah,
either way, we're
correct.
calling the vet, but that's good to know that it's not the oh my god, my horse went down. This is it. This is the end. It's just he's uncomfortable. Help and
Yeah,
keep an eye.
I think the rolling was associated with the displacement of the intestine because they can happen at the same time, right? But it's more
Okay.
that the displacement is causing the rolling rather than
Mm,
vice versa,
okay.
if that makes sense. Correlation does not
Causation.
equal
Yeah.
causation, right? So, yeah, like I said, there is a little bit of a wives' tale around that, right? An
Okay.
old wives' tale.
To
Just
deep
like
into
hand
the appropriate
walking,
we can.
you don't need to walk their feet off. If they're lying down peacefully, that's fine. If they're lying down and they seem a little uncomfy, fine. If they're running their feet off, if they're thrashing around, like that's not okay. We need we need to intervene in some way if it's safe. Only if
If
it's
it's
safe.
But then I got us
Can
off
I
track with
can I
mine.
ask a question?
Yeah.
Okay, so a torsion versus volvulus. I know you mentioned the volvulus actually like cuts off the blood supply and strangulates that blood supply to the colon or whatever is experiencing that. Does that
It's
same
usually
thing
the
happen with
small
a
intestine.
the small intestine? Does
Yeah.
that same thing happen in a torsion, or does then a torsion lead to like impaction because it's like narrowing or like I'm
The
curious.
When the mesentery twists, it cuts off the entire blood supply to a certain section of the gut. When you have a
Yes.
torsion, it's really just localized. I'm
Okay.
not gonna say it is better, but I'm not gonna say it's not good,
Sure.
but it's better than a volvulus because a volvulus, those are the colics that are, again, we don't wanna make this scary for people, but those are the
Right, right,
colics
right.
that can be rapidly fatal.
I see. Okay.
Yeah, so a torsion
Okay.
is less scary. It can cut off its own blood supply. You can also have things like intussusceptions where the intestine is actually telescoping on itself, and that can cause some blood supply problems as well. And obviously, like motility problems, nothing's going to move through it if it's like
Sure. Okay.
a sock on itself.
Right.
But yeah, so but that's a good point. The blood supply is cut off, and that's why we need to fix it. That's why it's painful.
Okay.
But it's not cutting off quite as much as if you
I
have
see.
a volvulus and
I
the
see.
whole mesentery is
Okay.
twisted on itself. That's
So let's say in a perfect world, you got in there, you found the ticking time bomb in time, you had this volvulus, you're able to, I imagine you have to remove necrotic tissue of whatever, like you mentioned, if there was blood supply lost for long enough and you have some type of necrotic tissue, you take it out and you've examined every square inch of the GI tract, which we know can take hours now. So you get to the end, what next?
like what comes at the like toward the end of the surgery,
Yeah,
or
like you close them up and call it a day, or is there more to it?
obviously it's a horse, so there's there's gonna be more to it. It can't just be that
Nothing can
easy.
be simple with these
Never.
Nothing
animals,
can be
man.
easy. Nothing can be easy. So my complete list of things that you can find during colic surgery, I will say you can also find just like simple displacements, which are pretty easy to fix, and then the severe impaction situation. So if a horse gets really impacted or has eaten something that it shouldn't, I've seen a horse that ate a metric ton of pea gravel, and we had to get it out of
Sure,
its
why not?
colon. It was so bad. Yeah, that was an interesting. It was like an industrial trash can worth of pea gravel. Yeah, it was
Naughty
crazy.
pony.
Yeah. Don't ever feed your horse hay on the ground over pea gravel because sometimes they'll eat it.
Good to
Okay, I'm
know.
sorry to take it. Okay, so I'm just curious now. So in an impaction scenario, is it just as, I won't say easy because I don't mean in any way, shape, or form that this is easy, but I guess is it as simple as like removing whatever is causing the impaction, or does impaction also lead to necrotic bowels?
Generally not.
Okay.
I mean, if an impaction is left for a really long time and it gets really dry and there's a lot of material in there, potentially that could
Okay.
damage the intestinal tissue. But generally what you're doing with an impaction is just getting that stuff out. So if it's a matter of like milking something out of the actual intestine, which doesn't usually doesn't usually work, but it can. Or in the case of the gravel, you had to make an incision and actually like rinse out all of the pea gravel. It was almost a shovel situation, yes.
That's really
And you have to keep everything sterile, which is crazy while you're trying to do all that. It's wild. But I will say surgeons are so good at what they do and know exactly what needs to be done and always take charge. So
my cat
The
had to have
viewers can't
the
see Jenna and I's face right now.
horror,
But listen,
the
I've
concern.
had horses my entire life, and I'm pretty well versed in most of, animal husbandry that is required to own horses. Like, I'm learning a lot right now, and I'm also like just kind of astounded at like how many different things can go wrong and so many different directions, and like how quickly these vets have to think and move and make decisions is just unbelievable. So to all the vets out there who perform life-saving colic surgeries on our besties, thank you, because this
Yes.
sounds so intimidating.
It's intense. It's intense. And surgeons enjoy what they do. They enjoy figuring out what the problem is and fixing it and making the horse feel better.
Yeah.
So
My cat had to go in for a blockage surgery early this year, which is not a colic surgery, but not dissimilar. He has no sense of self-preservation. He's fine now.
like
But
a urinary blockage or
no, he ate a piece of
like a
plastic
GI
that wouldn't
blockage?
pass through because, again, no sense of self-preservation. But I could not appreciate our surgeon more. She kept us updated. She was absolutely wonderful. And at the end of everything, I mean, she just took in my cat, who, by all intents and purposes, should not have done what he had done, saved his silly little life, is handling me sobbing on the phone, asking if he's going to be okay because I'm unwell. And then at the end of it, she's like, yeah, I'm really sorry. I had to shave his belly. I'm like, girl, the last thing I care
Least of our
is
worries.
that fluffy butthead stomach. Thank you so much for being concerned. She's like, I brushed out the rest of him. Like, he looked fine otherwise. So, like, my heart is with every animal surgeon out there. They are
best.
truly angels on earth, and I appreciate them all. And for her to be concerned about that after doing what she did, like, crazy.
You do have beautiful fluffy cats though, so I get it.
Yeah,
It's
I mean,
like
it
if
was
you
feedback.
it's like how it's a sacrilege if you have to clip feathers off of a draft horse.
Yeah.
It's it's just not something that you do. So if you have to do it as a vet, you sort of have to apologize and say, listen, I had to do this.
I imagine that it's how we feel when EMS arrives and we're like, do not cut the De Niro boots. Like, they have a zipper. Don't you
Take
cut
what
these
you
boots,
need,
okay?
transport my body, don't cut the
That's
boot.
right. Just
Cut
the
my
legs
leg off.
Like, totally, yeah. 100%.
Cut the leg off
Too
before
funny.
you cut the boot off. Yeah, that I actually my mom actually yelled at some EMS members one time, and
Don't do
I
it.
had brand new boots on, and they were
Don't cut them.
they were putting me on the
zippers.
Well, they didn't back then, but they were brand new custom boots, and my mom was like, "Do not cut those boots off."
I think for those of us who remember the days of the pull-on boots, though, like, there
Yes.
truly was the fear that people
Yes.
were not going to take the time to gently wiggle, yank, and pull to one side, then pull to
That's
the
right.
other that it took to get them off correctly.
Well,
Okay.
they cut up your sleeve so that they can get like your blood pressure and stuff. So they cut my show shirt up the
Sure.
sleeve, but they did not cut my boots.
Hey, listen.
My mother was not going to allow that to happen.
No,
So
no.
priorities, man.
Yep.
So one thing I want to, so I mentioned at the beginning of the episode that, like, I had made the decision that if Andy had colicked, or if and when, we're gonna knock on wood right now as I
Knock
head
on
into this
all the
conversation.
wood.
He has colic since I made this decision, but that given what I know the recovery to be like and what I know Andy to be like, that I think that him getting through the recovery is probably what's going to stop me from wanting to make that decision for him. So once surgery is over, like, walk us through what the average owner is going to face in terms of recovery, both acutely and long term, and what some of those struggles might look like for the horse and the owner.
Yeah. Thank you for getting me back on track.
No, you're
So-
okay. No, you're okay.
We're all complicated here.
I tend to go off on tangents. So you did ask what the recovery from the surgery actually looks like what happens after the abdomen is closed. So that at that point, you're going to roll the table into the recovery stall, which is usually a little bit different than the induction stall. They'll be hoisted off the table using those same hobbles. They're laid down in the recovery stall. They usually have a towel over their eyes so that the light doesn't startle them while they're waking up. They'll get sort of set up in there. And then the things that vary are some hospitals will just let them stand up on their own without assistance. Some hospitals will assist the head and not the tail. And some hospitals will do both, the head and the tail. So if you do the tail, you have to like tie a rope into their tail, and that can help them balance as they're standing up after surgery. So a lot of horse owners know this is where some bad things can happen after the surgery. If they get scared in the recovery stall and scramble, they can hurt themselves. So they are monitored very closely while they're waking up. Somebody has eyes on them the entire time that they're waking up until they are walked back to their stall. So so that usually takes maybe an hour for them to get up and be alert and be able to walk back, hour and a half. And then they're assisted usually as they walk back to the stall, like the regular bedded stall. A lot of times we'll assist them just by holding onto their tails. Honestly, if a horse was going to go over and you had their tail, you aren't going to do much, but you can stabilize them a little bit by holding onto their tail as they walk back. And then, like you said, you get home. And then what, right? So the horse is in the hospital for a few days. And as long as they are stable and, everything looks like it's doing fine, doesn't look like there's an infection starting, most horses will be on anti-inflammatories. Obviously, all horses will be on anti-inflammatories after surgery. And most of the time they'll get some antibiotics around the time of the surgery. Because of antibiotic resistance, we try to minimize that. So they have found that horses usually only need like a dose of antibiotics before, and some vets will do 1 dose after, some vets will do 2 doses after with the antibiotics. We try to not overuse antibiotics in veterinary medicine because of resistance issues. Yeah.
Yeah, that's smart. That's forward-thinking.
So usually by the time they go home, they're sort of off medications.
Well, how long is that? Like, how long are they going to stay in the hospital?
It varies. So, horses that have a complicated issue, sometimes when I was an intern, I had a horse that had a puncture. So really stiff piece of straw or hay perforated their small intestine. And we actually flushed that horse's abdomen every day, which is, it's crazy that you could do that. So when you close those horses, you put in like a drain and you can flush their abdomen, it's just
That's
wild
wild.
that you can do that. But that's because bacteria from the intestine leaked out into the abdomen and caused peritonitis. So that horse stayed in the hospital. Yeah. Yeah. Sorry. I didn't mean to trigger Ashley.
That's okay.
So that horse stayed in the hospital for a lot longer for care than a horse that just had like a simple displacement. So that would be, like I was saying, like the intestine just sort of flopping over on itself and getting stuck like that. You go in, fix it, close them up. Those horses are usually out of the hospital within like 3 days, 4 days. Again, every surgeon is going to have their own protocols. So if you're at New Bolton Center, there are specific protocols that the vets use there. Different hospitals have different ways of doing things. So if your vet or your surgical center is not doing things the way that I'm saying, it doesn't mean they're wrong. It doesn't mean I'm wrong. It just means people do things a little bit differently at different places. So
everybody does what works well for them and their team.
Yes.
Yeah, right.
So yeah, if everything has gone well, the other thing that happens, sorry, I forgot, they usually have a belly band placed. So you'll put an ioband, so it's like a protective sheet that's impregnated with iodine over their incision when everything is closed up. And then once they're standing, you put a belly band, so that's elastic on and some padding, just to support the abdominal muscles, to prevent things from swelling, to prevent contamination of the incision. You want to keep that really clean, obviously, because if bacteria get into that incision, they can potentially make their way up into the abdomen. So we want to avoid that at all costs. So horses usually go home with the belly band still on, but it usually can come off after they're home for a couple of days. You can just sort of cut the elastic on off and remove the belly band and the ioband. So then it's funny, I'm thinking of my horse that I sent to colic surgery in 2017, thinking back to Mike I. Elliott. So they come home and they have to be on stall rest, right? They can't move around a lot because of the incision. You have to allow for the incision to properly heal. So they're on stall rest. Usually, again, it depends on, what was done, what was found, how things are healing. But usually horses are on stall rest for 8 weeks, which is a long time. So, sometimes you have to get trazodone or some other kind of sedative, like long-term sedative. Horses don't always love being in a stall for 8 weeks. After 3 or 4 weeks, usually you can put them in a small pen. So small pen turnout, but that's only for a short period of time. So I still consider that the stall rest period, because they're really not they're not going out in a pasture. They're not getting ridden. They're not, they're not allowed to really run around. The first time I put Elliot out in the small pen, he completely lost his mind for about 5 seconds and then just looked around for food. So he was very happy to be out, and I cringed because he bucked a couple times. And I was like, oh God, please don't rip your incision open.
Acting like he pays his own vet bills.
Yeah.
Right?
That's
Right?
Yeah.
Like acting like you didn't just have major surgery on your abdomen. But then he was fine. He just wanted to get it out of his system. And then gradually during that time, during stall rest time, you can do a little bit of hand grazing too. Grass is really good for their GI tract. So, and I guess we can talk about refeeding and all that stuff too. But, doing little short grazing walks, not actual hand walks, you can usually do pretty early. A lot of times those horses are getting grazed a couple times a day at the surgical center while they're recovering because it's so good for them. It's good for their brains to get out of the stall, right? But it's also good for their GI tract to eat some nice fresh grass. So I got to go, when Elliot was in the hospital, I got to go hand graze him a couple times. That was really nice. So, and then gradually you can start like doing more hand walking and, if they're not moving around very much in their pen, like depending on the size of the pen, you can start to like move them around a little bit more over time. But it's usually 3 full months before they're back to like full riding, like exercise.
Yeah.
Again, all surgeons have their own protocol. Like a lot of places have it, like we'll give you a printout of what the schedule is for most horses. When they're discharged from the hospital, you'll get like a printout of, obviously also get like discharge instructions, but
Yeah, they're not sending
hospitals,
you home with like a salute. Like you're
yeah,
getting
yeah.
very
All right, good luck. Yeah. But in that time, you're also doing a lot of things like monitoring the incision a couple times a day to make sure there's not like heat, swelling, discharge, any of that stuff. Redness, if you can, if they happen to be like gray or white and you can see redness, you're going to really keep a close eye on that incision, keep it clean and dry, and, try to keep it as you can't keep it sterile, but try to keep it as clean as you possibly can.
Clean, yeah.
Yeah, without getting your fingers up in there because that doesn't help anybody.
That's not gonna help.
Dirty barn fingers on an incision, it makes me cringe. So, yeah, so you're gonna be, keeping an eye on all that stuff. But, as time goes on, they can move around more, they can eat more. Again, refeeding, they'll start to get refed when they're still in the hospital, so that's nice
And
because they're
refeeding, like that term really just means reintroducing like grain and concentrated meals.
and hay, it's forage too.
Okay.
So, yeah, so, um, they'll start usually by getting multiple very small meals of hay and hopefully like a nice soft hay. Sometimes you send your interns out to pull grass for horses.
Love
That
that.
can
Thank
be
you
that can be
again.
fun.
We appreciate you.
That's a fun intern job or extern job. If you've got an extern, that's a good job sometimes for an extern. No, we love interns and externs. But I only bring that up because I was sent out to pull grass for multiple patients.
Trauma bonding.
Trauma bonding, yes. So grass is really good for them, but then introducing hay, and then you usually wait for a while to reintroduce grain. Grain
Okay.
can be a little harder on their GI tract. It's a little harder to break down and digest. So you want to basically feed them what they would be eating naturally
Okay.
Yeah.
while their GI tract is like healing, feeling better, all those things. Again, if it's just a straightforward displacement, you just flop the intestine back over, everything else is fine. Recovery goes a lot faster. If there was an issue and you had to actually sort of hinted at this earlier, if you had to actually remove a necrotic or dead section of intestine, things can go a little bit slower as far as sort of everything goes. They're going to heal slower. You're going to refeed them a little bit more carefully just because, they've got sutures then in their intestine as opposed to just having something put back in place and, getting closed up. So that will alter their refeeding and recovery as well. It's just obviously a lot harder on their
Yeah.
GI tract. So
Yeah.
Makes sense.
Gosh.
again,
Well,
everything is different, right? Every situation is different. And, but trust your surgeon is,
yeah. Yeah.
is the key
And
there,
I'll be the first to say I've never sent a horse for colic surgery, knock on wood, of course. And but I mean, this is like it feels very intimidating. Like this is like a lot of decisions need to be made. And I can imagine based on what you mentioned earlier, Liz, that these situations can deteriorate very rapidly, that decisions have to be made by both the veterinarian and the owner very rapidly. And the whole thing is like making me have like double vision and it's scaring me. So I want to kind of introduce the idea of like ColiCare and why we brought this to life and,
Right. That's like
using
totally
it.
what we're talking about
Sorry,
this
I
right
mean,
now.
just because like as you're talking about all this, I'm thinking to myself, like, obviously ColiCare is a reimbursement program, and that's great, but I also feel like it's kind of like a little bit of like your pal to be there with. It sounds so lame because I've never had to use it, but like to know as the owner that you have that in your pocket with you, that you have the backing of SmartPak, our staff, our customer care line, like our people to kind of help you through such an intense experience. And the last thing you want to have to worry about is, how am I going to pay for this? There's so many decisions to be made. That's one less thing that you need to worry about.
And that's
So
exactly
I
what
kind
I
of,
always say about it
yeah.
too.
yeah,
Like, you don't in that moment, you don't want finances to be the thing that's making the decision for you, right?
absolutely.
All of my horses are enrolled in ColiCare. Even the horse that I had decided was not going to go to surgery, I had him enrolled in ColiCare because if in the moment I decided, like, I changed my mind and I said, we're
Yep.
sending him to colic surgery, I didn't want, a big vet bill to be the reason that I wasn't able to send him, or I felt like I wasn't able to send him. So even he was enrolled in ColiCare. To me, it's peace of mind.
Yeah.
And again, I'm so grateful that I have that for all of my guys because
Yeah.
I don't know, I just feel like it's a little bit of security.
Yeah. Yeah. And the one thing that I will say, because I have a senior too, is that I had to grapple on Andy's like 16th birthday with the fact that like he was no longer commercially insurable. And it's so look, okay, so first let's start off. We'll go into ColiCare, what ColiCare is, and then we'll come back to this point of eligibility because like we don't have an upper age limit on eligibility, which is amazing because most
Mhm.
commercial insurances that you're going to go through are not going to take people like people. I'm anthropomorphizing
People
my
like
horse a
Andy.
little bit. They're not going to take
They're
people like
people.
Andy.
They're just four-legged
They may
people.
not accept, right, cases like Andy. So let's talk about like what ColiCare is, Jenna. I don't know if you have like the bullets on in the top of your head from your customer care days of like exactly what is ColiCare and how does it work?
Yeah, I think there's something fun about this group of 3 because Dr. Liz also was on on customer care for a while too. So like she's talked to customers, she's done all this as
That's right.
well. So like there's I have the experience with ColiCare on that end, and Dr. Liz kind of has like the whole gamut of experiences with it. But from my memory and my knowledge and talking about ColiCare, like we said, it's a colic surgery reimbursement program. So you put your horse on a ColiCare eligible supplement. There's, I think, 7 of them in our repertoire. We're going to tag all of them in the show notes. And as long as your horse is on that supplement in a SmartPak, it's going to get delivered every month automatically. So, like, check that off of your mental load list as well. And you're following wellness requirements, which I'll go over in a second, and something happens, you've got the coverage. And for wellness requirements, like that sounds like a big scary thing. It's not. It's stuff you're probably already doing. It's having a veterinarian out to put eyes and hands on your horse once a year. It's following a deworming program. We're not telling you how to deworm your horse or when. It's just being confident that you are putting some kind of dewormer as is appropriate for the horse that you have in their body when it's necessary. It's following a vaccination routine as worked with by your vet. That's one thing that I do want to make sure people know is the vaccines do have to be administered by your veterinarian. They're the ones who have the science and the schooling and the backing. I know there are some people who like to do this themselves. So it's just something to keep in mind if you are interested in colic care. That's definitely something you want to have discussed with your veterinarian. And then it's just making sure that you're keeping up with the SmartPak shipments. So if you're getting a delivery every month, make sure that those are being fed, because if you do have to delay your shipment, I have to do it with my Chewy orders all the time. I didn't feed as much as I thought I was going to for food, so I'm going to back it off by a week. That's fine, every so often. But if you're delaying your shipment by, a month or more, it is going to change what the eligibility looks like. So a customer care rep can go over all of that way, way more in depth, answer any specific questions you have for your scenario and your horse and things like that. They're phenomenal. They'll walk you through everything, but that's kind of like the in a nutshell version of it. So it's a free program to enroll. I cannot stress that enough. If you're already putting your horse on the supplement, if it's already in their SmartPak, like go sign up, go enroll. You kind of might as well, right? Like we've already called it out. It's peace of mind. It's just an extra, pat on your back to know that you've got that. And I know, Ashley, you said like there's so many things that are happening, like it's intimidating. And I kind of feel like the other side of that coin, like, oh my gosh, there's so many decisions that a surgeon has to make. All I have to do
Totally.
is call the vet out, agree if they want to go to surgery, and know that I
Write the
can
check.
care hop and write the check at the
Right.
end of the day. Like it's so fewer things, knowing how many things that they have to determine that I have to
Totally.
do less than that. So it's a, each side of the coin kind of thing. But that's like the overall elevator pitch on ColiCare before
Yeah.
we talk more in depth.
Yeah. I'm starting to change my mind about like Andy right now is on Digest powder, and I'm like, maybe I should go back to Digest Ultra because I mean, you're not wrong. Like if I guess in that moment want to change my mind,
Then you
it is a
can. You
little bit
have the
more peace of
ability
mind-ish.
to.
Guys, this was not a sales pitch to anybody, but I think we just sold
You sold it to
me.
Ashley.
That's right.
Hey,
That's
I
right.
had my
Yeah.
horse until he was 27, and we made the decision to let him cross the Rainbow Bridge on a good day, so it didn't have to be a bad day, but he was on ColiCare until the exact day that he was no longer with us, and I don't know if I would have sent him at age 27, but I never wanted to have
Right.
to make the
You had
choice
the choice.
entirely on my
Yeah.
own.
That's right.
And
That's
And
right.
you don't have to take it from just, I mean, you should take it from Dr. Liz. I think you're a pretty solid resource. You don't have to take it from me and Ashley, but I will call out briefly too, like our sponsored riders, like our professional level people that rely on us and trust us, they've had to put horses through colic surgery. Boyd Martin, who's like a top Olympic eventer, like they've put their horses through colic surgery with the backing of ColiCare. It's pretty cool, and it's for anybody and everybody. Like you said, Ashley, there's no upper age limit. I'm pretty sure I'd have to double check this to be 100%, but I think the horse just has to be weaned
yeah,
to be eligible. Yeah,
6
there we
months
go.
old, I think, 5 or 6 months old
Yeah, if I was
and weaned.
and there's no over age limit. The only other thing that like does come into play is if your horse has a chronic history of colic, which you can talk about with a rep to really know what that means, or if they've had a prior colic surgery. It's kind of like insurance does, where it's just harder to insure. That said, just to reiterate, this is not insurance. Like we are not an insurance company. We're not doing insurance things. But if your horse is still on insurance, your horse has not been kicked off of the family plan yet, they can get colic care and insurance at the same time. So if it's one of those,
That's
well, I
right.
already have it. Okay, great, get more. Like, what's the harm in more free money? Because we don't
And
really get from the horse world.
I just wanted to clarify that there is a reason behind not allowing a lot of delays of the shipments. It's
Yeah,
not
you can probably speak to that
it's
better than
not
I.
about it's not about the money at all. It's just about making sure that the horse is receiving the hindgut support. So, all of these supplements provide hindgut support. Most colic occurs in the hindgut. So that's why our colic care eligible supplements are primarily hindgut supplements. There are some combo supplements and things like that, but they're all going to provide hindgut support. We just want to make sure that the horse is receiving the hindgut support. Again, it's not about the money. If there's been some sort of issue with your SmartPaks or with your orders or with shipments or whatever, feel free to call customer care and chat it out with them. But we just want to make sure that the horse is receiving the supplement. That's all that's about.
Yeah, which hopefully to everybody listening is like, yeah, that makes sense. Because to me, yeah, that makes sense. And a
Makes
couple of kind
sense.
of like fun fast facts on ColiCare. We currently have over 15,000 horses enrolled in the program. So add to the numbers, like join us. I'm gonna like one of us. One of us. Like it's worth it. It's definitely worth your time. I think we close somewhere around 100 claims a year. So like for 15,000 horses and 100 claims a year, like you can do the math on if that's, more scary than you thought or less scary than you thought. But again, just knowing that we're in your corner and we're here to have your back as much as possible, I think that's worth it. And then I think this is cool. So I actually reached out to the girl that we have here who handles the colic care claims. So like if you have to call the number, you have to make a claim like my horse is going for surgery, I'm on colic care, what do I do? As of right now, it's Lexi and she's fantastic. Lexi answers the phone and she's like, don't worry, I got you. And she walks you through everything. Or if for whatever reason she's like, I don't know, asleep and has to call you back, she'll call you back and be like, don't worry, we got you. But she told me, I can't believe I didn't know this. We also can do like donkeys and mules and things like that. And so I think that's so cute that we can have like donkey friends. So if you're like, well, my horses are insured, but my like pasture friend is just kind of like, out there in the wind. He doesn't have to be. He can be a part of it too. So also just cute to keep in mind that no matter the length of their ears, they can be a part of the game.
That's a good call out.
All
And
equids welcome.
all equids welcome. I also wanted to put it out there that like we've talked about a lot of stuff today and a lot of it sounds scary. And I just want to say, if you do have to send a horse to colic surgery, don't feel like you've done anything wrong. There are ways that we can try to keep their GI tracts healthy, but there don't feel bad. Don't feel like you've done something wrong if you do have to send a horse to colic surgery. It's just something that happens, and it's most likely not anybody's fault. It's just a thing that happens with horses.
That's a great call
Are
out.
you trying to say that there's no way that it could be my fault if my horse's GI tract gets stuck between their spleen and their kidney? That was certainly
You
not.
couldn't have done something about that,
I'm
Ashley?
telling
Come
you
on.
what, like Every time one of my horses colics, I think somebody like pulled them out onto the grass paddock when they shouldn't have been, or like it was a management issue. But now knowing that like so much of this is just like physiology and how things can go wrong, I actually feel like a little bit better that like maybe some of these things are not directly correlated to my mismanagement errors or things like that. So I appreciate that.
I will say there are things, and I think we'll probably talk about that in the next episode, but there are things that you can do to try to minimize the risk of colic.
Sure.
But
I mean, you can
again,
try to keep your horse from eating a bucket load of pea gravel, but you also have to know that your horse is opposed to eating a bucket load of pea gravel, and sometimes you don't know until you find things out.
Those owners had no idea.
Yeah.
And
I didn't know
so,
my cat was gonna eat an entire thing of plastic, and now here we are. Like, you learn as you go sometimes.
Yeah. You can't have your eyes on your horses 24 hours a day. It's just not something that you can do.
Yeah.
So, some horses are just going to eat pea gravel, and that's, it's like some cats just eat plastic. Some, if you have a Labrador Retriever, you're going to find them inside the trash can in your house at some point. So,
and there are things you can do to prepare. Like, I think we've all heard me say on episodes a million times, like preparedness guides. Like, we've had Ashley go through her like barn guides on all sorts of different things. Like, we're big proponents of checklists and doing what you can to mitigate. And like Dr. Liz said, we're going to talk about like colic and how we can help, mitigate risks of that. But something else just to kind of, start to tie up a little bit of what we've been talking about here is being prepared if there is this kind of emergency in your life, whether it's your horse, a friend's horse, a boarder's horse, whatever it may be. But having like some kind of a practical checklist, like, do you guys know where the local emergency hospital is? Do they know you? Do you know them? Do you have a plan for a trailer? If you own a trailer, is it in good condition? Is it somewhere it can be hooked up quickly? If you don't have a trailer, who can you call that's willing to be your kind of emergency person? Is there a service that does that in your area? If you need insurance paperwork, do you have that handy? Is it on a document on your phone? Is it saved in a binder that you can bring with you, or is it in your trailer? Emergency contacts. If you are going abroad and you know your horse colics every time you leave, looking at you, Jet, I still think about you all the time. Do you have emergency contacts for your horse that will, run down the line until we get to the vet and take the appropriate steps? Do you know what your horse's normal vital signs are? I feel like Ashley's been such a great champion of that in past episodes of like, know what their respiratory rate is, know how they recover from activity, be very aware of what your horse's general state of thriving looks like so you know when they're not. Financial plan, obviously we've talked a lot about ColiCare and how that $15,000 can really, really help you in times of emergency. But if you also think that you might want to have other things in place, having an account set aside if that's something you're able to do, knowing that you have people you can rely on, like if mom and dad are still in the picture and willing to help you out with your horse costs, more power to them and more power to you, whatever it takes. Sometimes it's a whole village. ColiCare enrollment, we could go on for days about that, but also just keeping in mind, veterinarian phone numbers. Are they somewhere in the barn? Are they in your phone? If your husband goes out to the barn, if your wife goes out to the barn, do they know who to call if something looks wrong if you're not available?
Like, I have my vet number on a whiteboard. I have a whiteboard in my barn.
Yes. Yeah.
I don't have boarders. I don't have anybody coming in and out of here.
Just so that you have it right there.
Our phone numbers and the vet's phone number are on my whiteboard. Like,
absolutely.
For who, I don't know.
Emergency preparedness.
Knowing if you ever need it. If anybody ever needs it, it's there. When I boarded at a barn full of 50 horses, every horse had a name plaque with like their name, their age, their owner, their horse's, the owner's phone number, and then also who their farrier was, phone number, who their vet was, phone number. Just keeping in
emergency
mind
contact, all the things.
Anybody can be there.
To that too, that an emergency is not the time to be establishing a relationship with a veterinarian. So
great call out.
Like, you want to make sure that you are having them out regularly. For me, that's twice annually for vaccines, dentals, whatever it is that they need, fecals. There are situations where you just move to the area and you haven't established a relationship with a veterinarian. Okay, that's fine. But, if you're established in an area, if you've been living here for a while, you want to make sure that you have a relationship with a veterinarian because, sometimes there's a veterinary shortage. Sometimes vets have to prioritize. And, if you're not a regular veterinarian or they're not your regular veterinarian and they're swamped, if they've got a bunch of other emergencies, they might say, try reaching out to this other practice. Whereas, a vet that you have an established relationship with will prioritize you a little bit more.
Yep.
So that's not the time to reach out to a vet. You want to get to know And again, I'm a veterinarian and I have my horse vets out twice a year
right.
at least. So
That's right.
And it's
if I could
also
do it, you could do it.
you have them out twice a year, like you said, that's also just establishing a baseline. So when you call and you're like, hey, homie's doing this, I don't think it's normal. Your
Right.
vet can corroborate and be like, you're right, that's not normal. Let's figure it out. Versus somebody who's never put eyes on your horse before, they don't know. And sometimes that's what happens. Sometimes you have no control over extenuating circumstances and it's the first time a vet's going to see your horse. It is what it is. But if you can avoid that, take the steps to avoid it when you can.
Yep. Again, I don't want to do any owner blaming or anything like that. Everybody's just trying their best out there.
That's right.
But do make sure that you establish a relationship with a veterinarian in your area. And if you have a vet and you don't happen to like them, you can find another veterinarian in your area. Just make sure you've got somebody that you trust to care for your horses, because
Yeah, and if you can, get on like a first name basis and maybe even like a texting basis with them. I'm not going to tell you how to accomplish that, but I'm going to tell you to do it.
I text my vets all the time.
Me too.
My vet used to get like weekly photos of my horse to be like, hey, he's still good. I haven't had to call you in a couple of weeks. Thanks, love you. Hope you're doing
Yeah.
well. And she'd be like, please.
That's right.
Proof
only
of life.
call me. Okay, just let you know. So this has been a lot. This has like been a really big episode. Dr. Liz, could not appreciate you more for coming in and giving us a literal play-by-play of how so much of this works. For me, knowledge truly is power and comfort. So I don't even have a horse right now, and I just feel better knowing what happens to horses when they do go in and come out successfully. But I think
we could have talked for another hour probably too about a bunch of other things, but I think we got a
We'll
good
have the
handle
next
on.
episode for that, right? The next episode is also on colic. So
yeah,
yes,
we got a
for
good handle
anybody
on.
who's been like, colic surgery is great. What the heck is colic, and how do I fix that? That sounds horrible and terrifying. It's okay. We're going to go through that. A lot of people do know what colic is, so I wanted to start off with something that maybe was a little bit less familiar. Next time, we are going to go through pretty much everything we can about colic, so like plan your time accordingly for that one. But I think for me on this episode, like we learned a lot. I learned about rectal exams and ultrasounds and beach balls and all sorts of stuff. But I think my biggest takeaway is quite frankly the same as it is episode after episode, which is know your horse, be familiar with what their life and their health and their thriving and their vitality looks like, because that's how you make the best next choices for if they don't have that going on. So that's, as always, kind of my takeaway. But I don't know if Dr. Liz or Ashley, if you guys had like a final note or a final takeaway that you guys wanted to add too.
I mean, I feel like my final takeaway of every episode is almost the same, and it is study your horse and know who they are and what their baseline is, so that when something is out of whack, you can identify it quickly. And every horse is different and their signs are going to be different, and every horse has different pain tolerance. And some horses are really stoic and some horses are not. So just know what your horse is. And when things are a little bit off, those little, micro hints that something could be wrong are like, I like to think of it like as I'm like solving some type of crime, and I have like my board with all my pieces of yarn, and I'm like trying to figure, so understand who your horse is and study them. And when something's wrong, you'll have a much better way of knowing and a quicker way of knowing if you understand their baseline. So
yeah, ultimately you know them best, and you're the stewards of their lives, so you're responsible for the decision making. And hopefully we didn't scare you guys too much. Hopefully we just gave you some good information, but it can be very overwhelming to think about this and talk about it. I know some people don't even like to say the word colic, so.
But you know what? I'd rather us be overwhelmed and scared right now talking about it than be overwhelmed and scared when we're in this situation and we have to make that type of decision like right then and there. So I think like being in an emergency is not the time to work through all these if-then scenarios for the first time. So food for thought for everybody, obviously not to be alarmist or to be, scaring people, but this is the reality of owning a horse. And I think these are definitely important topics to talk about. So we're awfully grateful that you joined us today. And, thank you for the listeners for hanging in. Jenna said this is a big episode. This might be one of our longest ones yet, but I think this is really important to do a deep, deep dive into the realities of what happens after you put your horse on that trailer. So Dr. Liz, thank you for imparting us with so much wisdom. We hope that you will join us for the next episode on colic and give everybody a deeper dive into the physiological happenings of what it means when we say a horse is colicking.
Yeah, thank you so much for having me. This is really fun chatting about all this stuff, and I can't wait to dig into colic a little bit more in the next episode.
You can find links to today's products in the show notes on your podcast player or on our website at www.smartpakequine.com/blog.
And we are here twice a month on the 15th and the 30th, but in between, find us on Instagram and Facebook as SmartPak or shop online at smartpakequine.com. Until next time, stay smart,
Stay prepared.
And give your horse a cookie from us.